Thanks so much. Well, it is a Tuesday morning, 28th day of August, back to school time for a lot of folks, and you know, as the summer season comes to a close, it's time to get back into the swing of things. Sometimes we let things go a bit during the summertime, and we have to think about keeping our teeth in great shape, and who better to bring back in than Dr. Andy Wiemeyer, back in the broadcast house with us on this rainy Tuesday morning. Dr. Wiemeyer, good morning.
Good morning, Rob. Good morning, Lisa.
Good morning. Welcome back.
Nice to see you. And of course, you have your practice in the town of Duxbury, and you can find out more at DuxburyDentistry.com, right?
Yes, that's our website, or Wiemeyer Dentistry.
WiemeierDentistry.com, and we're going to talk today about something that we all have to think about. It really is important, and if you do a little work, or actually take some steps, you can save yourself a lot of time and aggravation later on, right?
Yes, absolutely. So what I've done today is we're going to talk about sort of I put together a top 10 list. Everybody likes top 10 lists.
Yeah, the top 10 list.
Works for Letterman.
Yeah, we run David Letterman, sure, every morning.
Right.
So this is the top 10, but not necessarily in this order. These aren't necessarily
yeah,
the
so
top.
what it is it's a high risk for cavities top 10 list.
Okay, the high risk for cavities.
Basically a checklist of things that you may be doing that are making you at higher risk to get cavities.
Okay, well let's listen to these, and we'll talk about it and find out if we do any of these things ourselves. And you can listen, you know, and take that, you know, as you're driving around or at home. Think about this because these are important things. So, Dr. Wiemeyer, where do we want to start with?
Okay, well, first I'm just going to give you a quick 101 on how cavities work. There are hundreds of germs in the mouth. There's one specific one that causes cavities, and the reason why, and this is a germ that's transmitted from a caregiver by the time you're 1 year old, and by the time you're a year old, you've kind of got the hand of cards you're dealt, and you're going to have that. So you either have it or you don't. So some people are more susceptible to cavities than others. So,
okay.
but the way this germ works is when you eat sugar, the germ ingests the sugar, produces an acid. The acid burns a hole in your teeth.
Okay.
Fluoride makes tooth structure more acid resistant, so that's helpful.
Okay.
And saliva has mineral content in it, which neutralizes acids.
Okay.
So those are kind of the that's 101 on cavities.
Okay.
The first group, I'm going to just group these into 3 different groups just to sort of get through them. But the first group is basically high exposures to sugar for long periods of time. Okay, because it's a matter of time of exposure, not so much the amount of sugar, but the time of exposure. So the first one would be snacking after brushing before you go to bed.
Okay.
Okay.
Bad idea.
Because basically, then when you go to sleep, you have sugar on your teeth. Unless you were eating just celery. That's
a good point. So no, but leaving it sitting there is not a good idea to have that sitting on your teeth all night. So you brush your teeth, you're doing a good thing there. So why would you eat something afterwards? Sometimes you're tempted, and you don't want to do that. It's probably best not to have nougat and
anything sticky.
Yeah,
would be bad.
no,
So,
that would be a bad idea. Okay,
okay. So this is one that we run into a ton.
Yeah.
Coffee with sugar. Okay.
Oh.
Now it's not the coffee; it's the sugar. Because what happens is most of the time, unless you're drinking an espresso, you're not just slugging this thing back. You're drinking it over a period of time. Okay. So now you're bathing your teeth in sugar for a long period of time while you're drinking that coffee. And many people are serial coffee drinkers.
Yes.
Right, you drink it all day.
All right. So what if you get the coffee without sugar?
That's not a problem.
Okay.
Okay. So that's and you know, artificial sweeteners and things like that, not a problem either.
Okay.
Okay. Sports drinks, particularly while exercising. You get kids that do it at sports practices, people, you know, at the gym, treadmills, things like that. Figure sports drinks are good, you know, electrolytes and things like that. So they're marketed as good for you, you know, replenishing fluids.
Yes.
The problem is they have a ton of sugar in them, and they're very acidic. And so this combination of the two, and the fact that when you're exercising, you're not salivating a lot, so you've got sort of low salivary flow, which is taking away a protectant, and then you've got a lot of sugar and acid.
Oh, it's like a double whammy.
Yeah, think about that. Yeah,
that's
because the saliva is like your natural shield, and it's like a little bit down at that point.
Yes.
So, okay, so,
okay. Yeah, so that's one. And then hard candy habit. A lot of time people, Altoids and things like that.
Oh, yeah.
Okay, breath savers are fine. They're sugar-free. But many hard candies, and people have dry mouth, and so they have lemon drops and things like that, and they like to sort of just eat candies a lot. It's a problem.
And again, it's always in there.
Yep.
Yeah, okay.
And the last one would be sweet cocktails. I mean, most people like margaritas and stuff like that in the summer or whatever, but, you know, I suppose it's how many you drink.
Yeah. All All right, so we're going to leave that up to you. You know who you are on that one. Okay.
Okay, so the second group, so that's 5. The next 2 are just related to things that can decrease your salivary flow. Prescription medications. There are probably about 300 out there that have a side effect of
dry mouth.
Dry mouth.
Oh,
Okay.
definitely.
Antidepressants are probably the biggest offender in that. So you've got antidepressants, anti-anxiety meds, blood pressure meds. I mean, blood pressure meds are very common. You know, as far as types of medications, and then other prescription. If you look on the, we have a list in our office. There are about 300.
All right, so this could possibly affect your dental health and make you more susceptible to cavities.
Yeah, it drops your shield.
Okay. Yeah.
So the other one would be just over-the-counter meds such as allergy meds. Okay, Claritin, Allegra. I mean, because again, they dry you out. I mean, that's the whole point of them, to keep your nose from running and stuff like that. But
It's true.
okay, so what are some answers there? What would you recommend? Because obviously the people, they need their heart, they need their blood pressure medicine, they need their. What do you just say? Just again, it's just something to be aware of. Drink water.
Yeah. So if you're, it's not so much the decrease in saliva, but it's a combination of decrease in saliva and then sugar exposure. So if you're on those meds, you're going to be more susceptible, more sensitive to some of those other 5 that I've discussed as far as coffee with the sugar.
Okay, just keeping so top of mind awareness.
You know, some of these work together against, you know, so if you're on blood pressure meds and you drink coffee with sugar in it all day long, you're going to be at more risk than if you weren't taking those meds.
It's good to keep in mind.
Yeah.
Yeah.
All right, well, I know we're out of time, so try to get almost just out of time.
Okay. Just the last ones would be just old dental work that's trapping food, areas where you're getting food caught when you're eating between teeth, and then braces make it tough.
Oh boy, I remember those days. Yeah,
so.
that's a natural trap. Unfortunately, it's part of something that goes along. You need those.
Yeah.
You want your teeth straightened out, but you just got to be really extra.
Regular care to your dentist. Regular care with your dentist. Fluoride treatments are helpful.
Dr. Andy Wiemeyer has been with us this morning. Some good tips. I feel a little bit better now, Lisa, and I think we have been guilty of doing these things, as we all are. And sometimes in the summertime, I love those glasses of lemonade. It's this place that they give you the glass of lemonade. They put the rim. They've got like sugar on the rim of the glass. Yeah. I have about like 2 or 3 of those. It's bad. It's bad. Okay. All right. Dr. Andy Wiemeyer, give us the information so people can get in touch and make an appointment.
781-934-5292 is our phone number. WiemeyerDentistry.com or DuxburyDentistry.com, either of those.
All right.
And check out our website.
We got a link right on our guest page. Go to the Tuesday page on the South Shores Morning News and check it out. Andy Wiemeyer, thank you so much for being with us.
Oh, thank you, Rob. Thank you, Lisa.
Traffic and weather's coming right up.